As a physical therapist, these are the 5 biggest red flags that I see in bad clinics that you need to avoid. So, the first red flag that you need to avoid is whenever you're scheduled with a physical therapist, after that first appointment, if you notice that they didn't have you do any functional movement during the actual assessment, then that's a major red flag of they're not properly testing you and seeing what kind of poor movement patterns or habits that you have that are possibly causing your pain. So, for example, with general low back pain, so this is not including like scoliosis, a herniated disc, no specific diagnosis, just let's say you had low back pain for over a year and your medical doctor diagnosed you with general low back pain, all right? No specific cause. So, for example, if you go to your first appointment and they just do general measurements where they tell you to, bend backwards, bend forward, maybe even do a squat, it's not really a thorough assessment of what your body is telling you in terms of what's causing your pain specifically, like what is the source. So, for example, like if let's say maybe you started feeling the back pain after bending down and picking up something moderately heavy from the floor. One of the things as a physical therapist that they should test you on is let me see you pick up this pen or pick up this water bottle from the floor. So that way they can get a more functional understanding of how you're actually moving and what compensations you're making. So if you're trying to pick up that pen or that bottle from the floor, maybe you're extending a little bit too much with your lumbar spine as you come up, or you just have way too much bend in your lumbar spine. You're flexing too much, and that's causing a little bit too much pressure, maybe on the disc or other structures of your spine. So after your assessment, depending on what the diagnosis is, you should notice that your therapist, if they do this correctly, that they had you do something functional in terms of a specific movement related to your pain or maybe what caused your pain. That's one of the things that is super necessary to have in a thorough evaluation, because just checking the general strength, whether that's with their hand or with maybe even like something a little more objective, some kind of scale, those are good to tell us what maybe deficits in terms of strength you have and imbalances. But to get to the root cause of what's causing your pain, we need to see more functional movements that you do on a daily basis that may be contributing to, for example, in this case, general low back pain that you've been having for that whole year. Usually when you have low back pain like that, it's something repetitive or prolonged that you're doing in your day-to-day routine. So the better understanding that we have of how you're typically moving, that's going to give us a little bit more insight of, all right, these are the changes that we need to make or the interventions that we need to add. But we won't have that information unless we do specific testing of how you're functionally moving. So that can be something as just looking at your sitting posture or how you're performing, your daily routines functionally. Okay. The second biggest red flag that I see, and I've seen this at multiple clinics that maybe that I've actually worked at, or even that I volunteered at, or just heard about. So if you, let's say after you have your first appointment, now it's time for you to talk to the front desk, and you're making your schedule. If they schedule you with more than 2 therapists, and this can be the actual physical therapist or maybe even a physical therapy assistant, if they schedule with more than 2 different therapists, that's a big red flag and a sign that the therapist that you're seeing, their schedule is overbooked, and this clinic is likely a very high volume clinic. So that means you're bouncing from therapist to therapist to therapist. Now, obviously for the patient, like for you, what you want to have is continuity in your care, meaning that you're seeing primarily the same person, the same therapist every session, because they're going to have the best understanding of what you're being seen for in terms of diagnosis, what they evaluated, what they assessed, and how they want to intervene and treat you actually. So being with that same evaluating therapist, That is key. That's ideal. But sometimes our schedules are just busy. So having one other therapist or therapist assistant that you're seeing, and you kind of bounce between two, that's actually not too bad of a system where both of them can collaborate in terms of your care, and then how you're progressing and maybe different ways that you can progress your treatment sessions in the future. But if you're seeing, 3+ therapists, you're bouncing around, and not every therapist is going to have this time to look at every visit you completed. So it's going to be a little bit difficult for that, actually the treating therapist, that third or fourth one, to see, oh, what have this patient has, what have they been working on? Like, what's their diagnosis again? Let me take the time to go through every single visit that they had, right before I see them. So for you, if you notice that the front desk schedules you with 3 or more different therapists, that's a red flag, and you want to avoid that at all costs. Okay, now this third red flag is one of the biggest one, that this is a sign a clinic is definitely high volume, and the primary focus of that clinic and their goal is really just to see as many patients as they can. And as a patient, that's not what you want, because then you want more time spent with your therapist. So the third red flag is, if you're spending 10 to 15 minutes with your actual therapist, whether that's the doctor of physical therapy or the physical therapy assistant, that is way too short. Your goal, is to have either 30 minutes or the full session with the treating therapist in that session. If you're only getting to see your therapist for 10 to 15 minutes, that means you're not getting as much quality of care as possible, and you're just getting, so one example that I've seen in some of these clinics is, all right, sometimes it might take 5 minutes for you to go to your appointment and actually have a 5-minute conversation with your therapist in terms of how your pain has changed, what actually has changed since your last session. Sometimes things happen where you might have a busy day and you move a wrong way, or something happens since your last session that your pain is worse, or there's just a change in your symptoms that wasn't there before and you're not sure why. So having that conversation with the treating therapist is important to catch them up on, okay, I did this and now I feel this. I'm not sure what happened. And then your therapist is going to respond accordingly and try to figure out, okay, what may have happened in terms of mechanism of injury that caused your symptoms to change or increase. So that dialogue, that back and forth, and getting a good assessment of the changes, that may take 5 minutes, may take even more, depending how severe. So if you're only getting 10 to 15 minutes, well, that just took out 50% or a third of your treatment time, of the time you actually spent with the therapist. So it's like, if you're only getting 10 to 15 minutes with your treating therapist, that is not enough time on a weekly and daily basis to see them. And there are many clinics that in your area will probably offer the full session with the therapist, or at least half of it, and then the other half you'll be working to do exercise with their aide. So that's the third one, and that's one of my pet peeves. So time spent with your therapist is very important. So if it's less than 15 minutes, it's only 10 to 15, that's not enough. All right, the fourth biggest red flag that I see is the clinic that you go to, they may not have the tools or the equipment that you need necessarily, depending on your diagnosis. So I'm gonna give you an example. I remember doing one of my internships at a clinic, and I was seeing a patient who was they'd be considered like a pediatric patient. They were just trying to return to playing soccer after doing they had a fall and sprained their ankle. It was just a minor sprain, but their goal was to return to playing soccer. And with that, initially the exercises that you're doing for, a low grade ankle sprain, they're pretty moderate, where they're low impact, less risk, just isolating and activating certain muscles, getting the muscles around the ankle just turn on. So you don't need too much equipment or actually space. But as they progress, get better, and have to enter the later phases where they need to work on return to sport or return to their specific activity, now you're going to need a little bit more equipment, whether that's, different boxes to jump off of to work on landing control, or even having just more space in general to work on sprinting, to work on agility, to work on different running drills or running mechanics. So now if you're in a small clinic, which is at the time when I was at this clinic for one of my internships, the clinic was it was small. It only had room for a few pieces of equipment. So for example, like a bike, a Stairmaster, and like a Pilates reformer. And that was pretty much it. And then the rest were, a few tables, treatment tables, where patients could do like lying down exercises with bands. But for this patient, once they reach that later stage where their focus should primarily work on, more cutting, more running, more plyometrics, and those types of drills, now you need the appropriate equipment and tools and space for that diagnosis. So once we got to that point, obviously I've treated this patient for X amount of time, got them better, but being able to recognize, okay, these are your goals, and we can hit a lot of these goals and get you close to being, better to return for the sport, to play soccer again. But you may want to transfer your care to another facility or clinic that has, like an indoor or outdoor turf, or just more space where they can work more specifically on these exercises and drills that will help you gain full confidence and strength and dynamic balance to be able to adequately perform all the demands of soccer and or of the sport that they're choosing to go back to. So if, for example, if let's say, you've tried physical therapy in a clinic, different machines, bed exercises, and your doctor also wrote, aquatic therapy would be good, but this specific clinic that you've been going to doesn't have a pool, well, and you haven't gotten results at the clinic that you've been at, you should probably go to a clinic that has aquatic therapy. If it's a distance thing where it's just a little bit out of your range that you prefer to drive, in my opinion, it's worth it to get the actual care that you need, because you need those specific tools, equipment, or space for the diagnosis. Because if you want to really improve, those things are going to matter in your treatment care. So look out for that in terms of which clinics you decide to go to. If they don't have the equipment that your doctor or that you necessarily need, or that the therapist recommends, then you should look to transition to another clinic. Okay, so the fifth biggest red flag is, let's say you've been seeing your physical therapist or physical therapist assistant for, a month, 2 months, and you've gone through a period where, I've had, 5 visits, it seems like, maybe even like 3 or less, where it seems like you're doing the same routine over and over. You're still working on these bed exercises that haven't changed. Maybe you've changed like the difficulty of the band. You went from like a red to a green to a blue, but that pretty much all the exercises that you're still working on are the same, and you're not noticing too much of a difference in terms of the pain. You're not really feeling the correct muscles turning on or any changes in soreness, but the exercise routine feels the same. So what's happening there is you're not getting the adequate attention from the therapist in terms of, are they looking to actually progress you every session? Because then after you have that first appointment, now it's time for the treatment and the intervention. So after 2-3 follow-up visits, most likely the therapist has given you different exercises to work on, whether that's for mobility, balance, or like almost like a therapeutic exercise to work on activating certain muscles. They should be giving you some kind of manual intervention, whether that's like a hands-on massage, some kind of joint mobilization, something where they're doing a technique where they're helping you move your body in a way that you're not typically moving it, right? Now, once they add in those interventions where they're having you do exercises, they're working on how you're moving your body or any deficiencies or issues with some of the tissues that you have, whether that's like tightness or flexibility issue or a circulation issue. They're doing some kind of intervention for your movement and the tissues, but you're doing the same thing over and over and there's just no change. That's a big red flag that you're kind of like you're in the back of their mind. They're not focusing on trying to progress you and change something every visit, because as they apply intervention, typically you should notice some sort of change the day of, the day after. Like, this can be a change almost like immediately, like right after. All right, after this exercise, I want you to feel this muscle of your hip working in a way that you don't typically feel it working when you're walking or when you're doing your own different exercises, right? And then if you're just consistently doing the same thing over and over, then that means they're not really checking to see how you're responding, how your body is responding to their interventions. So our goal as physical therapists is, one, we test something, we see how your body is moving, whether that's the strength or the quality of movement. And then we apply an intervention. Okay, you're going to do this exercise. You're going to feel this muscle working, and it's going to help you stand without your hip dropping, right? So every intervention should have an appropriate response. Now, if your body is not getting the response that we need, or it's not giving a big enough response, then we modify or even change the intervention. So whether that's a whole different exercise or just modifying how you're performing it. Maybe you're compensating, maybe your form is a little off. So if you're doing the same thing over and over and your form in general is fine, the exercise is not too difficult, then at that point it's time, and actually whether that's the aide, the assistant, or the therapist, it should be recognized that you've been working on some of the same things for a while. Now, there are some cases where, okay, maybe this patient is in a lot of pain, so we can't really progress too many things, whether that's how many exercises or how difficult the exercise is. You can't progress too much if the patient is in such acute severe pain, because they're not going to be able to tolerate it. But if that's not your case, where you're like, my pain is it's the same, it's not too severe, but I'm still doing these same exercises, well, that's a big red flag that your case, you as a patient, are not getting the actual attention from the therapist that you need, and that you probably should request a different therapist or look for a different clinic. Because then at the end of the day, you should be with physical therapy, you should be making progress in some sort of way, whether that's the severity of your pain, whether that's your strength, your mobility, your balance, your overall confidence, whether, if you're a fall risk, something should be improving week by week. Now, the scale of how much it improves, that's going to change, vary person to person, depending on the diagnosis. But in general, you should have some kind of objective or even a subjective improvement of your progress week by week. If any of these 5 red flags sound a little bit what your clinic is like, then it's probably a sign that you need to find another clinic and get out of there fast. I definitely don't recommend seeing a therapist or assistant that is implementing any of these things and you having to just to deal with it. There's way better care out there. There's way too many therapists that can give you better care in another clinic. So I hope that helped. If you enjoyed the video, please subscribe, and I'll see you in the next video.